They have been hailed as heroes, rightfully so, during the pandemic. But emergency room nurses say they're facing verbal and even physical abuse while on the job.
Yeah, I can't even imagine. And now nurses and hospital officials are speaking out. Channel 3's Mike Savino is joining us live from Hartford Hospital. And Mike, exactly how much of a problem is this?
No one I talked to had numbers exactly, but I can put it in some context. Now, even before the pandemic, 1 in 4 nurses reported being assaulted, so this is not a new issue. But one executive that I talked to says that this is becoming almost a daily occurrence now.
We need to change the working conditions for healthcare professionals.
Hospital staff continue to work through tough conditions. Staffing shortages and rising COVID cases have them feeling overworked. But now they're dealing with another concern, their own safety.
Nurses have been being kicked, hit, pushed.
Nationwide, hospitals have reported that their staffs are seeing increased violence, especially in emergency rooms. Connecticut hospitals say that's happening here too.
It's very unusual now not to have a morning report that reports an employee reporting to occupational health because they have been assaulted by a patient.
Nurses have always faced some threat of violence. A 2019 study by the American Nurses Association found that 1 in 4 nurses reported being assaulted. But nurses say 2 factors are driving an increase: longer wait times in emergency rooms and the political arguments around vaccine and COVID rules.
It's because we're asking them if they have all their vaccines updated, and it becomes this politically charged conversation, which is, not the intent.
We asked executives at Connecticut's 2 biggest healthcare networks about this. Here's what they had to say.
People are really tired, so civility and kindness will help reduce the sense of frustration that our teams have.
At times, we need not be able to meet the expectations of the family of the patients or vice versa. And we've had some conversations around that.
Meanwhile, nurses warn that the confrontations and assaults are just one of the many things driving people from the profession.
People are quitting to do anything else. They're like, it's just not worth it anymore.
Now, that nurse that you just heard from, she did have some tips that people can follow to help with the situation. First and foremost is that think about, do you have an emergency or do you have a situation that can get treated at your doctor's office or an urgent care facility and doesn't require you to go to an emergency room? Second, if you do have to go to an ER, provide all the information you can so that the staff can properly prioritize your case. And then third, if you are not in a life-threatening situation but have to go to an emergency room, do expect to have to wait for a while. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.
Mike, thank you very much.